Hello, I'm Dr. Jonathan Amspacher, and I wanted to take a few minutes to talk to you today about a procedure known as lower body lift or belt lipectomy or circumferential abdominoplasty. And what that is that's a very powerful procedure that some patients choose to undergo after they've been through massive weight loss. Massive weight loss patients are different than an average tummy tuck or abdominoplasty patient because instead of having lost 20 or 30 pounds, in many cases they've lost 70, 100, 150, or even over 200 pounds in some cases. And so what that does is that these patients mean they have a lot more excess skin, both in the abdomen area as well as the posterior buttock area, the low back, and they've lost and had deflation of the buttocks. And so we use a procedure which combines a front incision along with a posterior incision in order to go all the way around the patient to correct the full truncal deformity at the mid-body level to give the patient the best outcome and the most level of improvement that we possibly can in one procedure. And so we usually start and work on the posterior side, and the posterior lift helps tighten up the skin on the back side. If patients have had a lot of deflation of the buttocks, we also frequently will add other adjunctive procedures such as a purse string gluteoplasty, which is a very powerful procedure to combine with lower body lift because it creates and shapes the buttocks to give a little bit of projection and get rid of that really flattened buttocks appearance that many patients who have had massive weight loss have. And so it improves that, and then we carry the incision around to the anterior or front side, and it's more of a similar procedure to abdominoplasty at that point because it tightens the rectus muscles, it removes excess skin, and with combining it with a back procedure, though, it allows us to tighten the sides much more than you'd be able to in a standard procedure. And so patients who are good candidates for a lower body lift have had massive amounts of weight loss. They have had their weight stabilized for a minimum of 3 months, better 6 months. They have good nutritional labs. They've been non-smoking for a minimum of 6 weeks, and they can afford to have a little downtime from work where they can really take care of themselves, recover, and get the best outcome. If you want to know more about lower body lift, please continue to research on Real Self, and thank you very much for your time today, and best of luck on your journey.